So here are the 6 steps that are involved in intervention mapping. The first one is needs assessment. The second one is program objectives. The third one is theory-based methods and practical strategies. The fourth one is program design, program implementation, and the evaluation plan. It sounds straightforward, right? Pretty much straightforward. We can almost figure out what activities go in these different stages, right? Okay, in the next few slides, I'm going to give you some detailed tasks that are involved in each of the steps, the 6 steps. And in these slides, I would like you to reflect back on what you as a group were able to write, what you missed, where you got it right, and just reflect on that as we continue. So let's first look at the needs assessment. So before the intervention, the intervention of behavioral change, we need to do the needs assessment. In doing the needs assessment, so first we need to establish a working group. We need to establish a working group of technical experts, stakeholders. Stakeholders means people of other organizations. If your intervention is in Kyoto University, you need to probably work with people from the hospital, from this department, and from another department, or from administration. So stakeholders. You need to involve stakeholders. And then you also need to consult with the users of the program you are designing. They should be part of ideally of your group. So establishing this planning group, aim for breadth and depth of the knowledge that you will get. And then start on to conduct the needs assessment, describe the population and the health program very clearly in a way that is able to measure. You have to define what is the program, who is affected, and how you can be able to input any intervention. And then also there's environmental aspect. You need to survey the environment in terms of policies, in terms of group norms. You need to understand the environment very carefully. And there is a model or a framework that is popular in this intervention mapping. It's called the proceed actually. This model diagnoses the population you're working with. It diagnoses many factors that contribute to the program you're working with. And then it also guides a team to assess causes of health problems at multiple levels, at individual level, interpersonal level, organizational level. This model helps you to diagnose different problems at that stage. And then also at this stage, it's when you first initially write down the problem. The program goals, the problem, you specifically state it down at this stage. And I want you to notice that this is not the final time you will write the goals of the project. The goals of the project might change as you gain more information, as you do your reviews. And in literature review, it can be, it can be primary data. It can also be secondary data. You can review other people's work, or you can use data from different sources, or you can go out and conduct the research yourself. So it can be different. So next, I want to share some of the steps that we actually did in SwaziYolo study. First, we established a working team of collaborators here in this department. And then we also established collaborators in Ministry of Health in Swaziland and some non-governmental organizations and game development company, it was in Cape Town, as well as a game publisher in Japan. You can see that already this team is multidisciplinary. You have people from the game aspect, you have people from Ministry of Health, you have people from NGO. These people are going to help us actually know what is acceptable, what the situation is in terms of policies to change behavior in Swaziland. We didn't want to just go off on a tangent. We wanted to already, the intervention was going to be built in the strategies and priorities of the country. And the only way you can know this, apart from reading policies, is to involve the policymakers within your team. So we did a lot of consultation between Japan, South Africa, and Swaziland. And as you can imagine, it might be very difficult to get everyone to sit down in a meeting like this. So it was a lot of moving up and down to collaborate on this. And then also we specified the overall goals of the intervention. And I want to mention to you that at this stage, we didn't have funding. So you want to design an intervention, but you haven't set out the goals yet. So there's no funding. But you need to collaborate with partners to understand what's going on in the situation. But you need money for that. But there's no funding at this point. And you don't even know if you will get funding or not, usually at this stage. So it's quite interesting. Now I can talk back and list very nicely the steps that we did. But actually there was a lot of uncertainty in each of the steps. Right. So if you can imagine speaking to someone, Minister of Health in your country, telling them that you're thinking about designing a game for HIV prevention. Imagine how they look at you. Is this guy crazy? At that time when we started in 2011, 12, 13, you had to explicitly define what a game for health is, what a serious game is. No one really understood what you meant. Is this guy joking? We are talking about adults here, 25 years or more older. They don't play games. You know, for them a game is just for 5-year or 2-year-olds. So at that time there's a lot of uncertainty. But you need to find people who will agree on a vision. It's not anywhere, it's just your vision. And often, if you're lucky, maybe you already have some funding, but sometimes you don't have any funding. You just say, we want to do this, but want to find money. We don't yet have funding for the project. But you need to establish it. And then also we consulted with the internet service provider in Swaziland to actually know the internet speed, the download speeds, and who were using which phone. So we needed to know the distribution of phones in the country, because we wanted to see if people would actually use the game. So we consulted with them as well. And we, of course, searched literature. We reviewed Cochrane Library for interventions for sexual behavior change. We read a lot of systematic reviews, cross-section studies, both in Swaziland and in the region. And also we reviewed serious games already that were already in the space. Actually, 99% of the games we reviewed were outside of Swaziland, or Africa for that matter. And then also we attended a serious games conference where we actually really got to understand the trends of what was happening in the field, because you had many experts from all over the world sitting down for about 3 or 4 days in one conference. So you could meet from morning to sunset. You could meet people who are designing games and talk to them, hear their stories. So it was fascinating. For us, it was part of the needs assessment stage of the game. We also conducted one-to-one interviews. We sat with people we considered our target audience, people we thought that they would use this game. We sat with them and asked what they wanted, if whether or not they would use such a game. And actually, in conducting the needs assessment, we did our own study, the Facebook study. So we realized that people were saying they would actually use information on an interactive platform. In fact, that is why we decided to take this route of developing a game. So those were the steps we took in the needs assessment for SwaziYolo game. And the next step is program objectives. So the most important things to underline in needs assessment is involving stakeholders and involving their consumer, the people who will use the intervention. So next is program objectives. So we need to set program objectives. And in program objectives, actually, the end goal, the end product of this step is a matrix of change. Is a matrix of change made of change objectives. Change objectives are compiled using performance objectives and changeable determinants. In this way, let me show you. First, for performance objectives, these define what the recipients of the intervention need to do in order to achieve the project or program outcomes. So performance objectives define what the recipient of the intervention needs to do. What is it that they need to do to achieve the goals of the project or the program, right? Specific things. So for example, if you have someone as your target who has this kind of habit to sit and just watch TV all day, you need to really think very hard in your performance objectives on what they need to do in order to move from here to being active, right? These are very specific things that you need to compile. And then next, in the changeable determinants, the next task is to select important and changeable determinants of described behaviors rooted in the findings from the needs assessment. So, for example, you have the performance objectives and you have the changeable determinants. These both come together to make up the change objectives of the intervention. So you use a matrix to do this, and this is called the change matrix. So you have the determinant up here. What will determine whether or not this person will change the behavior? For example, knowledge. For simplicity, let's just assume it's knowledge. So they need knowledge. Okay, and what is the performance outcome for this objective? They have knowledge, but what is the performance outcome for this objective? And then from there, you design the change objective. You do this for all the performance objectives that you desire to have. So most important part here is to ask what needs to change related to the determinant of the program for the participants to achieve the program objective. Okay. So in our SwaziYolo experience, we stated the performance objectives and we stated together with timelines. So we wanted to know when they will do this, at what time. And then we used qualitative and quantitative studies, interviews to segment our population, our target population, to gain insights into what we consider to be the determinants of what we wanted to change. In our study, it became very obvious that we needed to focus on perception of risk, because we learned from interviews, from literature, that people were already well aware of the basic facts in Swaziland. They know what HIV is, they know how to get tested, they know how to prevent HIV, for example, using a condom. So people relatively knew these basic facts. So we quickly decided that the big problem, it's one of the problems, but not the only problem. The big problem is perception of risk. We asked in our qualitative study, we asked people what they thought HIV prevalence was in the country. They told us. Every single one of them in our one-to-one interviews told us that it was very high. How high? They thought even the national prevalence statistics was not accurate. In fact, they thought it was even higher, because at that time everyone knew someone who had at least died of HIV, either a friend or a colleague or something. So they thought it was very high. But then when you ask them, what about your individual risk? What do you think about your risk? And they told, no, for me it's okay. I don't think I can get HIV. So we realized that there's low risk perception, which we wanted to work towards. And then we identified important change objectives, such as I already said, risk perception and intention to change behavior.